Hi, all. I hope you're having an amazing week. We're going to finish up our week talking about physical and health disabilities. Now, a student that has a physical or health disability and requires special education, it means that their physical disability or their orthopedic impairment has to be severe and adversely affect their educational performance. Now, if it's a health disability or an other health impairment, we abbreviate that OHI. It could be things such as limited strength, vitality, alertness, and these are usually chronic health conditions like asthma, ADHD, diabetes, epilepsy, heart condition, hemophilia, leukemia, sickle cell, Tourette's. And these are things, again, it has to adversely affect their educational performance. So, how do these relate to special education? Now, not all physical disabilities are going to require special education. Remember, it's twofold. It has to be severe and it has to adversely affect the educational performance. So, physical disabilities may need some accommodations, but not all health disabilities are going to require special education. It has to be limited strength, vitality, alertness due to a chronic health problem, and twofold again, adversely affect the educational performance of the student. We have two groupings of physical disabilities. First, we have neuromotor impairments, and these are things like epilepsy, cerebral palsy, muscular dystrophy, multiple sclerosis. And then we have muscular skeletal conditions, and these are things like limb deficiencies, as you saw with my niece Eleanor, or juvenile arthritis as well would fall under that category. When you look at major health disabilities, we look at things like chronic diseases versus infectious diseases. Under chronic illness, we look at things like asthma, blood disorders, diabetes, cystic fibrosis, sickle cell anemia versus infectious diseases like hepatitis, HIV, AIDS, tuberculosis. Then these things are so wide and varied, and we've been looking at characteristics that are in common between different ones. And what's with this one, each student is so incredibly unique, and each condition is so unique to each student. But what they do have in common is their needs are going to vary greatly over time versus based on the current condition of their health. And physical and health disabilities, these are really stressful on families as well. So you'll notice stress in families. So when you were looking at the different disabilities themselves, so things like cerebral palsy, when we look at this is going to affect motor functioning and sometimes cause jerky movements or spasms and sometimes problems producing intelligible speech. And about 1/2 of these individuals also have some type of intellectual disability as well. Then you get to something like diabetes, and it can result in clumsiness, speech difficulty, blurred vision, headaches, or seizures. And then sickle cell anemia, you're going to get episodic sickling and extreme pain, swollen joints, high fever, and sometimes even strokes. So what are the prevalence of these? Well, they're not reported separately. They're reported together under IDEA. And physical disabilities, it's assumed it's approximately 1% of school children versus health disabilities are going to be about 12%. But remember, again, not all students with physical and health disabilities are going to receive special education services. Some individuals can also have multiple conditions, and it's reported underneath a different educational category. Now, 80% of these students are going to receive their education inside the regular classroom, 80% or more a day. When we look at physical disabilities, about 55% of them do. If it's a health disability, about 64%. Sometimes students with physical and health disabilities have to receive their education in other locations, such as a separate classroom or the home or even a hospital setting. Now, there are some common challenges. There's going to be limitations in physical abilities, either impaired or restricted mobility, and some access to the school environment is going to be limited. Sometimes it'll be impaired motor functioning, which limits or prevents movements or speech. Poor health and episodic health crisis is going to result in various amounts of absenteeism and reduced participation because the students aren't there. Students are also going to be tired a lot. And if you've watched the videos embedded with Ellie, who has cerebral palsy, she talks about how tired she is just sitting up during the course of the day because of the muscles involved in just holding the body upright. So how can we help with some of these challenges? Braces can be used to increase motor function. And I know if I've said it once, I've said it 1,000 times. Universal design for learning. Having the information presented in different ways in the classroom. Peer note takers, distance education, sometimes it's necessary that it is remote. Working closely with their service providers, having accommodations and assistive technology for the students. And then you need to help the students access the curriculum and be able to demonstrate their learning using technology and not being afraid to use technology to support that distance education. Having digital textbooks or flexible schedules. If you have a student who gets tired by noon, you want to put some of those harder classes in the morning so they can be more alert and absorb the information. Allow students to use word processing systems and accommodate for service animals in your classroom. You also need to reduce barriers to the physical environment. Think about your classroom. Having students not keep backpacks next to their desk, having a singular location for them, moving your desks around so you can improve traffic patterns, flexible seating arrangements, having items stored where students can access them in one place, and creating space for wheelchairs to be able to go by, putting visual reminders at the height that can be viewed from a wheelchair. Don't hang it up so high in the class that they can't see it anymore. And then these students, early identification is important. Newborn screening, and these are tests that can detect disorders such as congenital hyperthyroidism, congenital toxoplasm, cystic fibrosis, sickle cell. And so early identification means early treatment, and it allows for preventable actions. It helps prevent serious problems such as brain damage or organ damage or even death if you treat it early enough. And medications and dietary restrictions can relieve some of the impact of the conditions. Early hearing detection and intervention, and we'll talk about this when it comes to deaf and hard of hearing, this will help identify children who struggle to hear. So sometimes you will be called into the role in the classroom when a medical emergency takes place for these students. And so you need to know the procedures for addressing medical emergencies your child, your student might face. These could be things like seizures, choking, bleeding, head traumas, allergic reactions. And many students with special healthcare needs have an individualized healthcare plan, an IHP. And so in there's going to be information about the medication, the activity levels they can do, dietary needs, equipment, transportation, and the emergency procedures you'll need to do at a classroom. So for example, if there's a seizure at school, a seizure, frankly, it's an abnormal burst of electrical energy in the brain. And what it does is it interrupts the normal brain function. Only 4 to 6% of all children have this. And seizures can result in a loss of consciousness, uncontrolled eye movements, body jerks, can cause a student to fall to the floor. Epilepsy is a neuromotor impairment, and this is a person who has 2 or more seizures. They're prone to the seizures. 1% of children have this, and it's usually not lifelong. It can be successfully controlled with communication, or with medication. So what do you do as a teacher? If you have a seizure in your classroom, first and foremost, remain calm. Students are going to pick up on your anxiety, your nerves, and they're going to emulate that. So you've got to remain calm. You've got to reassure the child, reassure the classmates that this student is safe. Ignore things that are beyond your control on the seizure, the jerking or the movements. Know how to recognize and respond as a teacher to different types of seizures. I had one student who had seizures and they didn't have jerky movements or fall to the floor. They just completely, their eyes glazed over completely and totally, and there was no physical response to them. So know what seizures to expect. Talk to the parents. related services that these kids can have. School nurse is going to be your friend when you've got these students. They often act as the case managers and coordinate implementation of accommodations and modifications. You oftentimes have physical therapists and occupational therapists coming to the schools to help these students with physical movement and fine motor and gross motor skills. And they'll also help determine what assistive techniques, as far as technology in particular, would be beneficial to these students in your classroom.